Good evening, I'm Dr. Akl. I am cancer specialist in Flint. Today I will talk to you about an important topic: when the cancer spread to the brain. When cancer spread to the brain, that's not necessarily equal to death. Let me tell you that. In the old days, we used to know that when the tumor spread to the brain, all patients will not make it. Today is different. Today we look at what type of cancer, how many lesions in the brain, how far from diagnosis of the cancer until the tumor came to the brain. And recently many study and many treatment devices has been generated in the past few years, and the treatment became specific for brain metastases. And as a matter of fact, reports showed that significant number of patients could live 5 years and more. What happened is when the tumor go to the brain, the whole brain is at risk, because if you have one tumor or more there, you could see with CAT scan or MRI, that means there is multiple small tumor we do not see. So the first thing is to treat the whole brain with radiation, to treat what you see and to treat what you don't see. After that, if you have 1, 2, 3 lesions or less or more, you need to make decision. Neurosurgery play a role as well as stereotactic radiation. If this tumor could be removed with no harm to the patient, with surgery, that's good treatment, because the neurosurgeon will remove what we see, and the radiation take care of what we do not see. An alternative treatment to the neurosurgical approach of removing big tumor is stereotactic radiation or stereotactic radiotherapy. What does that mean? A focused beam of radiation come to this tumor and only treat the tumor to a high dose, and the tumor should disappear, and in some reports this tumor will be gone equivalent to doing surgery, especially for smaller size and delivering adequate dose of radiation. So we are in an era could cure brain spread or brain metastasis or spread of cancer to the brain. Of course, we have to select our patients, those who are younger or those who got good performance status. Those do the best, and those two factors are the most important predictors of outcome: age and performance status. Other factors, of course, is the extent of spread of cancer, the type of tumor, the time from diagnosis original cancer until the tumor show up, and the location of the tumor, size of the tumor, and of course, as I mentioned earlier, number of the tumor in the brain. So the initial step, number 1, to treat the whole brain with radiation, or if the patient want to go for surgery first or other treatment first, that's fine. So if patient will go for surgery, for those lesions easily accessible, the neurosurgeon go ahead and remove the tumor. Then a radiation oncologist give whole brain radiation, usually between 5 to 15, sometimes 20 treatment, but those give equivalent doses to the brain. If the neurosurgeon found it is difficult to do surgery, or if there is many tumor and so on, we do what we call it stereotactic radiosurgery, or stereotactic radiotherapy, same thing. There is no surgery involved, but we call it stereotactic radiosurgery, even though the treatment is a radiation treatment. That's basically we do special mask to the patient, so patient is not moving during such treatment. We do CAT scan to know exactly where the location of the lesion. We do MRI of the brain and diffuse the image of the MRI to the CAT scan image, then know exactly what area to treat. We draw such area, then we prepare the patient for the treatment, usually a single treatment. A single treatment to the lesion in the brain usually take care of it. And those patients who got less number of lesions, one do better than two, do better than three, smaller size do better than larger size, and so on, those patients do the best. And treatment is successful, and in many scenarios is comparable to surgical treatment. So today we are able to cure or extend life or certain population of patients with brain tumor. Those patients able to live more than 5 years. And those who are younger with good performance status, they do the best. Those with less number of tumor, smaller tumor, time from the original cancer until it showed in the brain, the longer the time, the better the outcome. A radiation treatment to the brain is advanced today, as after we have stereotactic treatment, we have more precision, we push the dose to the tumor, spare normal tissue, and we have special quality assurance to make sure the treatment precisely with the millimeter factor deliver the dose to the tumor, and patients do well. This era where stereotactic radiotherapy play a major role in treating brain tumor. So if a patient with cancer heard they got tumor in the brain, again, do not panic. You need to wait until to sit with your cancer specialist, who will talk to you about what could be done to this tumor. And again, if you are from those selective cases, you could live longer, and some patients live more than 5 years, and the outcome is good. Also, the side effect of stereotactic radiosurgery is not high, and those few side effects are well dealt with, and many of them are temporary. So the outcome is excellent, and God willing, you do well and be at high level. So cancer, what I wanted to tell our patients today was the development and advancement of new technology. We're able to treat metastatic cancer to the brain for those special population who are good risk, and their life expectancy could expand up to 5 years or even more.